Kim Liana and I am here at CSA. On my last episode here at CSA, I've done Foxy Eye Tread Lift. And as you can see, lifted na talaga yung dito sa around my eye area. And this past few months, I've been experiencing acne breakouts. That's why Dr. Contessa will be doing some treatments to improve my skin quality. First is Eladerm. Also, I'll be getting a Botox and Ultherapy for that V contour face. Don't forget to like, subscribe, and hit the notification bell to keep you updated.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a follow-up. Let's welcome back Kim Liana.
Hello, everyone. Hello, Doc.
Hello. Last time we did the periorbital rejuvenation, and I'm looking at Kim right now. Very rejuvenated periorbital area. So it was a combination. So we did the Fox Eye Tread Lift. And we did some under-eye treatments as well. Today, we'll be managing skin condition, the skin quality. Now, Kim, of course, we girls, we still get this zits, acne, pimples. Yan. How was your problem on your pimples?
Grabe, Doc. It's been like kalahating year.
Yeah, right.
Ng parang acne breakout.
Acne breakout. Like, it started where? Which part of the face?
Forehead po. Forehead.
Yeah. Would you mind? We can show it to our audience. We can like share with you guys her forehead area, what it looked like. Actually, she shared with me last time. Ayan. So there's like a video here showing the appearance of her forehead. So this was the initial like acne problem that we had before, right?
Yes po.
Yeah. So if you notice, they're inflamed type of acne. So there's redness, inflammation, and there's also signs of flakiness there. And then after the forehead.
Yes, after the forehead.
Ito?
Yes, yun po, Doc.
So on the lower part of the face, actually there's this like, yeah, this one that you sent also. Like there's inflamed acne there, kind of like not only pustular, inflamed papular acne, some kind of like cystic acne a little bit. And those kinds of inflamed acne, those are the ones that tend to have a mark, the acne marks. So acne marks can either be like post-inflammatory hyperpigmentation, or the others would have the atrophic acne scar. Those are the ones that are sunken. And good thing with Kim, we didn't have those sunken acne marks, because she was also kind of messaging me, Doc, what treatment we need to manage? That's why when you get the inflamed type of acne, you really have to seek consult and get a treatment. So we have given Kim oral medications, and we also combined with some skincare, right? And now we'll be treating some of the marks, the PIH or post-inflammatory hyperpigmentation. The others will have PIE, post-inflammatory erythema. So instead of brown discoloration, they will get erythema or redness. So we have here treatments to clear those acne marks. So we have devices, energy-based devices, even lasers to target PIH or PIE. And since you're already here with us, Kim, so we're also doing the maintenance of her V-contour treatment or that good jawline. Because in the past, we were concerned about some of the jowl, beginning jowl, particularly on the left side. And we want to maintain. And of course, women should have a narrow bigonial width, or this one, the lower third of the face. You should have a narrow bigonial or the angle of the mandible, the width. So, pag babae, kailangan parang inverted triangle. Pag lalaki, square. So, we wanted to maintain that well-contoured jawline. We'll also be adding the so-called Botox, a maintenance. And also to, again, address some of the jowl fats, we'll be applying or using our Ulthera. We'll show the procedures when we return. And we're back, so we're still with Kim. Are you excited?
Yes.
Yeah, I'm excited too. So we'll start with the Botox, okay? So for the right side here, we want to make our marking, corner of the mouth to our tragus, and then anterior border, the antegonial notch, bite please. And you can feel the masseter, anterior border, and this one inferior and a posterior one. And we'll be making 3 injection points. And same thing on the other side. So you can make your marking for your Botox, okay? Your tragus to your corner of the mouth, anterior border. You can palpate for the antegonial notch and then bite please, okay? And then your inferior and your posterior. And then I always give a 1 cm kind of like a marking in the anterior border of the masseter to avoid the risorius muscle and prevent that kind of asymmetrical smile. So 3 injection points here. Then after doing this, we'll be also working on the jowl here. This is the main concern of Kim, the left jowl here. She's maintaining that kind of like very sexy jawline there. So the goal is the so-called, nowadays they're calling snatch jaw or sexy jaw, okay? So a while ago, they cleansed the skin and also applied topical numbing cream, because after this, we'll be doing the so-called Eladerm radiofrequency microneedling to target those acne marks, okay? So I'll start with this one, okay? So since I did the marking, let's change our gloves. I'll be using my botulinum toxin for the masseter injection. We want the masseter to be relaxed. Take note that the masseter is a muscle that has this kind of like compartments as well. So kind of like there's a superior, there's an inferior part. There's this so-called DIT or the deep inferior tendon that subdivides this muscle, the masseter compartments. So we want to target all those parts of our masseter to prevent the so-called paradoxical bulging. So disinfect please. Just gonna apply a so-called 3 injection points. And the thing is, not really much of the prominence here. So usually the side that has the most prominence is the side where you always chew. Where do you always chew?
Dito, Doc.
There you go. So the left side is dominant because that's the side that's most active and the side she always use in chewing, okay? So when you exercise the muscle, it makes the muscle bigger. It's causing this so-called masseter hypertrophy. I tell my patients to avoid chewing those nuts or hard to chew food, steak, meat, okay? So if you want to have a slimmer masseter, then just chew soft food. But of course, you don't want to deprive yourself of those steak. So once in a while, you also do that. Now I'll work with this Ulthera. I'm using the 3.0 millimeter transducer to target the so-called jowl fats or superficial fat pad. I'm just gonna give shots on this jowl area here. I'll focus on this left side because this is the one that's kind of more dominant compared to the right side, okay? So we want to balance the face of Kim. So again, this is maintaining that symmetrical face. So you can give as much as 30 shots in this area. I'll subdivide my shots. I'll also use the 1.5 millimeter to target the dermis fibroblasts and induce a solid tightening and firming of the tissues there. So let me just deliver some 15 shots here. And I will still do my Ulthera on the right side to make it balanced. But this part I'll combine with the 3.0 and the 1.5, okay? So for doctors doing this, it's good to also kind of like modify or make your treatment customized for your patient. And I'll use the 1.5 millimeter depth. So the Ulthera thing, the good thing with this is it targets different layers. It can have the so-called mask layer, targets the mask layer with your 4.5, your 3.0 targets your superficial fat pad, and your 1.5 targets your dermis layer to stimulate your fibroblasts to synthesize new collagen. So this is a versatile treatment. It's multi-layered, and it's like a treatment that you can do once a year or in a year. You can do it twice or 3 times or more depending on the need. So it's not only like once a year, you can do more of this in a year to really maintain that lifted and tight and firm skin, contoured face. And if you want to target some of the loose fats, excess fats, you can use this device right now. So I'm doing 30 shots just particularly on this jowl area here. So when I'm doing my Ulthera, I can target specific areas here. And then I'll work on the right side of the face. Actually, some of my patients, whenever I do this, we can see an instant result already. There's like a tightening effect instantly. So your Ulthera emits a certain thermal energy, and it reaches the soft tissues inside, and it induces that instant contraction effect on the soft tissue. So we love the Ulthera since it's non-invasive. It is USA approved, USA FDA approved for this non-surgical facelifting. For those who are looking for non-invasive treatments, this will be the best treatment for you, especially for those people who just want to maintain and at the same time don't want a long downtime and don't want to really alter too much of their features of the face. So this is easy. This is a quick treatment, no downtime, and very safe. Okay, so I'm done with the Ulthera. So now we'll be doing our Eladerm. This is a radiofrequency microneedling device that targets acne scars, acne marks. It also tightens the skin, firms the skin. It's really a good device for total improvement of the skin quality. So kindly cleanse this area here, please. So I have this tip here. Okay, so it has this micro needles, and the tip of the needle will deliver a radio frequency energy, and that will be the one that's gonna tap or target the dermis fibroblast, stimulating collagenesis, elastogenesis. So clean the area, disinfect the area. So our main target will be those areas with these acne marks, okay? So I'll be working on the lower part first, so do my shot. You're good?
Yes.
Okay. So the depth should be like, ideally for the mid-face to lower face, you can use the 2 millimeter depth to 2.5 millimeter depth. And the energy is, it should be an optimal energy to be able to have that good result, okay? So you're doing good.
Yes.
And then you just continue with this side here. You can do 1 to 2 passes depending on the need. Usually when I do this, I finish with my full pass, first pass, full face. And then after that, the second pass will just target the areas with those acne marks. Okay, you're still good. Yeah. So after this treatment, it's expected to have some redness or erythema. It's just gonna go away in like few minutes. Especially we have here Helite. The Helite is a type of a LED light therapy that emits a certain wavelength to heal, to help the skin recover faster. So I'm doing already this part here. So you can still do the upper part of the face. We can shift to the upper part of the face. You want to also tighten and firm the skin there. So this is a device that can be combined with your injectables. You can combine it with your filler, with your threads. Then if you're doing injections of botulinum toxin, you can do it before those botulinum toxin or days after your botulinum toxin. Okay, so you notice I did botulinum toxin on the jaw area, on the jaw tox part or the masseter part. So I'm just in a 2 millimeter depth, so I'm not reaching the masseter region. Okay, so I'll do the other side, the left side, after I have done my Colshine. I'll be combining her treatment with the collagen. We call it Collagen type 1. And Collagen type 1, this is like a natural and a safe collagen to inject into the dermis. We have been doing this for a long time already. And the type 1 collagen is the type of collagen that is present in the dermis. So we need this to sustain the strength, the structural support in the dermis area. Okay, so our dermis is made up of 80% collagen. As we age, this collagen goes away. And Kim is already turning 26. Yes. So at the age of 25, we're starting to have a reduction of our collagen, 1 to 1.5% in a year. So this is a start. So disinfect these. So this is just a method we do for this Colshine. Disinfect the entire area. And we will be applying it via intradermal application. And when I say intradermal, this is just like in the dermis layer, and you'll just make those tiny blebs, small blebs. You can do like a 1 centimeter interval, or you can even make this injection very close to each other, especially this is collagen type 1. And this will improve the skin quality and will also help with the repair. And the good thing with this one is it can be used for those acne scars, acne marks. And since you already have collagen injected, you don't need to wait for collagen to be formed. So while you inject your collagen, since your Eladerm will be the one to sustain the collagen formation or production. So Kim Liana is having a red mark and a brown mark, a combination, both PIH and PIE. She asked me a while ago, what's the difference? Because PIE is common for those with lighter Fitzpatrick type of skin, like Fitzpatrick 1 and 2. PIH is more of the colored skin. So those with rich in melanocytes, they're prone to so-called PIH, the brown pigmentation. So Kim here is combination. Okay, so we'll also work on this side here. So just a little bit more. This is just an easy technique, a quick technique. I'm using the 234 needle, gauge 35 2 millimeter length. So this is for me, I've done this. It's painless for me. I don't even need like a topical lidocaine. Okay, so we'll do the other side. we are done. Let's show the result when we return. And we're back, so let's show the result to Kim. Kim, here's our mirror. So we did Botox, we did Ultherapy, we also had the Eladerm radiofrequency microneedling and the Colshine injection. We added the collagen type 1 to help the dermis layer regenerate, and at the same time, you kind of like replenish the skin with the natural collagen that you have. Okay, how was it, Kim?
Ngayon may redness siya, Doc.
Yeah, that's normal.
Later on,
Yeah.
matatanggal naman dahil
Right.
sa heal line.
Yes.
Pero instant lifted talaga yung face.
Yeah, it's noticeable that there's this kind of like the contraction of the soft tissues inside when we did the Botox. And also the Eladerm, we noticed that kind of like the skin instantly tightens.
Yes.
Although you will still see the results as time passes by. You know, when we do Eladerm, we tell our clients that there is this collagenesis from 4th week to 8th week to 12th week. So as like weeks, months will pass by, you're noticing your skin is getting better and better. Yes. There you go.
So normal lang po ito. Kasi
right.
nagkaroon ako ng first session ng ganito. So.
Yes. We did this already. We had done this type of treatment for Kim, that every after this procedure, expect redness. And then, gradually, it's going away. Actually, it was redder a while ago. Yeah. And then, we will still do Healite, which is a kind of a device. It's a healing device. It emits certain wavelengths. It's therapeutic. It's gonna remove that redness. So, tomorrow, you're good. So, today, it's just gonna be like that. Plus, those Colshine injection marks, the tiny blebs, 1 hour to 3 hours, they will go away already. Okay, so no worries on that one. So this is a combination procedure, a maintenance procedure. The good thing is we were able to control the inflamed acne. Okay, whenever we treat those types of acne, those like cystic acne, the treatment will take months, okay? So you have to be patient. And it's not just like, you know, you come to us, then don't expect that in a day or two, it's magically away. So it's a process because the acne condition, it goes in stages also. So it starts from the comedone to papules to pustules. And if those who suffer from inflamed type of acne, they may get some of the cystic or nodular type of acne. So there's a staging of the acne conditions or grading. May mga grading yan eh. And according to the grade of the acne, we manage the problem. So we have like a specific treatment for every grade of acne problem. So it's really like a process. It's not just days or weeks. It will be months, especially for those who suffer from really severe or very severe type of acne conditions. Plus for women, it's like combined with other factors eh. Siyempre, hormonal, monthly cycle, and then like we women, we always put on our cosmetic products. Those are like factors that could contribute or aggravate acne conditions. But the good thing is we're happy that we were able to control it in a span of like how many months then?
6 months.
Yeah, usually 6-month treatment with this type of acne, inflamed acne condition. And we are just getting rid again of the pimple marks. The good thing is you don't have the craters, yung mga pitted scars because they're really hard to manage. So we just want to maintain that smooth, pimple-free skin, flawless skin, spotless skin, oil-free skin, yan. So we want to have that clear skin. And you know, having that good skin, clear skin, it makes you confident, right? And so, we've been with Kim for quite some time already. You can check her other episodes. Look at the transformation. Dati talagang obvious yung face asymmetry eh. So, we were able to correct that. And plus, I love the effect on the eye area. It's just the right outcome, the optimal outcome, a natural outcome. It's not making her look like, you know, those awkward faces. Yung mga parang chubby face, puffy face. So we want a contoured, angled face with the right convexity, right proportions, and that is beauty.
Yes.
Thank you.
Thank you,
So
Doc.
you'll still have your Healite, you'll still apply some skin boosters, and we will advise you proper skincare.
Thank you so much, Doc. Totoo po yung sinabi ni Doc na yung confidence talaga na naapektuhan po nung nagkaroon ako ng acne breakouts. And I'm very much thankful to Doc Contessa for clearing up the acne po.
Right. And we're glad to help. Yeah.
So, talagang mas okay po na to go to your trusted dermatologist instead na mag-self
Yung mga over-the-counter.
Yes po.
You might have a reaction. I remembered, nag-self-medicate siya.
Opo.
Nagkaroon ng irritable dermatitis.
Opo.
It worsened the problem. There you go.
Thank
Thank you
you
for
po, Doc.
trusting us.
Thank you, Doc.
Yan. Okay. If you have, naluha na ang ating Kim. If you have any questions, you may email us at csaskinclinic@yahoo.com, our FB page, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. And our videos, please keep watching them. And Kim has several videos already.
Yes.
And we're following Kim at
Kim Liana on Facebook and Kim Liana DP po sa Instagram.
Yes. Follow us also at our Instagram, CSA Medical Aesthetics. And our videos, our YouTube channel, Contessa Salvador. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.